Hey guys, Dr. Abby here from Restore Chiropractic Rehab, and today we're here to talk about Shockwave. Shockwave is one of those newer treatments in the rehab world, and it is really showing some good promise. We've just incorporated it into our practice this last January, and we have really seen some good results with things that are more chronic in nature. Today we're going to talk about what Shockwave is, how it works, what it feels like, and who it might benefit. So what is Shockwave? Shockwave is this machine here, this guy. It emits a radial pulse wave into the soft tissues using a percussive nature. So you can see on the tip of the handle here, there's a little metal piece. And that metal piece is percussive. So it goes in and out and it pushes that radial wave into the body. It can get to a depth of about 2.4 inches at the most. So we can really get into some of those deeper tissues, which is really beneficial considering my hands can't always do that. And the other techniques that we utilize are good, but they don't always get that to that depth. So how does it work? Once that radial wave is in the body, what does it do? It targets those soft tissues, things like muscles, tendons, ligaments, and it helps to break up any like scar tissues or adhesions that are in there. So whenever you have blood flow coming to the area in a targeted zone, that also brings in healing factors. So think about a chronic injury as it's kind of stuck in this inflammatory cycle, just churning there. It's never quite getting out of it. So there might be portions where it feels better, and then there's times where it feels worse. And then it's better and worse, better and worse. So this might be familiar to you with injuries you might be experiencing. So this is where the Shockwave comes in and it kind of pushes you through and out of that inflammatory cycle, and therefore healing those tissues. So we've got blood flow to the area, we've got healing factors to the area, we've got breakdown of those scar tissues, adhesions, things that are keeping us from that functional movement patterns that we need. And then in addition, we also get a reduction in pain as well through all of those factors. And what does it feel like? So it's not the most comfortable treatment, but it's also not the worst by any means. The other nice thing about Shockwave is it's variable, so we can change it according to the patient. So if the patient is experiencing a lot of discomfort with the treatment, we can decrease the intensity. We can also increase the frequency. So we talked about before how this little piece here goes in and out. Well, we can increase the frequency of that, which helps to decrease your discomfort level. Overall treatment time is really pretty short. We're talking 2 to 5 minutes in most instances. So quick, a little bit of discomfort. A lot of patients describe it as snappy because again, that little piece that's going in and out, it's hitting the skin, and that's where that snappiness comes from. But like I said before, we can tailor that treatment to you depending on what you are feeling. So how does Shockwave fit into our practice? Shockwave is one of those things that complements what we do already. So it's not the magic pill. I know we haven't found that magic pill yet, but we're working on it. Shockwave is the thing that comes in and accelerates our treatments because it's going to break down that inflammatory cycle a little bit faster, or like we talked about before, those chronic things that have just been ongoing and ongoing, or I've tried everything but nothing works. This is where Shockwave comes in and can kind of break that barrier and give us a little bit of a step ahead so that we can really make more progress with our chiropractic care, our soft tissue work, and our rehab. Rehab is one of the big ones, so that's going to complement Shockwave because Shockwave breaks down the issue and then we can rebuild it with the rehab. So who is Shockwave for? We definitely need to do an evaluation before we just start with Shockwave because we want to make sure that you are the right candidate for Shockwave. But like we mentioned before, those chronic unending injuries, those are the ones that we're looking for. Things like plantar fasciitis, rotator cuff issues, Achilles tendonitis, elbow issues like golfer's elbow, tennis elbow, things like that. Those are the things that are probably the most commonly used in our office with this machine. However, it can be used on pretty much any soft tissues, just depending on what it is and how long it's been going on. So if any of this is speaking to you and you think you might be a candidate, give us a call today and we can get you in for an evaluation and see if Shockwave is something that might benefit you.